And now, Healthline with award-winning medical correspondent Phil Rainier.
Thanks for staying with us. You're fortunate if you even survive a gunshot wound to the head. The majority of people don't. That's exactly why doctors for Congresswoman Giffords have been cautiously optimistic after an assassination attempt left her with a bullet wound to the brain. At last word, Giffords was still improving but remained in critical condition. It's a scenario Baton Rouge neurosurgeon Gerald Molloy is familiar with. He's treated more than his share of gunshot wounds. He says anytime a bullet enters the brain, surviving is just the first hill a patient must climb.
We have to keep in mind that the frontal sections of the brain controlling the motor function for half the body, and the rear sections of the brain controlling both vision and sensory functions for half the body. I think it remains to be seen what damage has been done here.
If any of those areas are damaged, it could lead to lifelong disabilities, not unlike former Reagan aide James Brady, the kind that he suffered after a bullet aimed at the president hit him instead. Tonight in Healthline at 10, the connection between Baton Rouge neurosurgeon Gerald Molloy and that tragic incident in U.S. history, and what he says about Congresswoman Giffords' recovery.
Earlier, we updated the condition of Congresswoman Gabrielle Giffords in Arizona. Doctors say she is now alert and responsive.
Which is amazing. She was shot in the head during a weekend alleged assassination attempt. And tonight in 9 Healthline, Phil Rainier talks to a Baton Rouge neurosurgeon about Giffords' injuries and his own personal experience involving efforts to kill a sitting president.
This is a picture of Congresswoman Gabrielle Giffords taken moments after she was shot in the head Saturday.
I think statistically she's beaten the odds by surviving.
Neurosurgeon Gerald Molloy should know. He's seen bullet wounds to the brain in Baton Rouge and as a medical student at George Washington University in Washington, D.C. He was in D.C. in 1981 when President Reagan was shot, and on campus when Reagan arrived at Washington University Hospital.
As I recall, it was just a lot of turmoil at in Washington on that day.
And the commencement of
Reagan aide James Brady was hit by one of the bullets meant for the president, and like the Congresswoman, he was shot in the head. Brady survived, but was left partially paralyzed and with slurred speech.
We have to keep in mind that the frontal sections of the brain controlling the motor function for half the body, and the rear sections of the brain controlling both vision and sensory functions for half the body.
Whenever those areas are damaged by a bullet traveling the length of the brain, there's a chance of long-term disabilities. At this point, there's nothing to suggest Congresswoman Giffords will not fully recover. But Dr. Molloy will tell you his experience with bullet wounds to the brain as a surgeon and a trained observer of the Brady shooting have taught him time is the only way to know the full effect of an injury like Giffords.
I think it remains to be seen what damage has been done here.
In the meantime, doctors will continue to do what they can to prevent infection or other complications that could reverse the progress Congresswoman Giffords has already made. With Healthline, Phil Rainier, WAFB 9 News.